Good morning, madam. Please would you introduce yourself?
My name is Joy Phumaphi. I'm the Executive Secretary of the African Leaders Malaria Alliance, which is an alliance of the African heads of state and government. And what the alliance does is get the political leaders on the continent to commit to the fight against malaria, not just to support their ministers of health, but also to make sure that they bring together all of society in the fight against malaria.
And you have a strong background in political leadership yourself, I think.
Well, I was a politician at one point. I used to be a member of parliament in Botswana, and I was Minister of Health in the Republic of Botswana. After that, I left and joined the World Health Organization as Assistant Director General for Family and Community Health. And being responsible for family and community health, one of the diseases that I was extremely concerned about, because it affects the livelihoods of families and communities, particularly in the rural areas, was malaria. But of course, other diseases, communicable diseases like HIV, AIDS, tuberculosis, and the neglected tropical diseases on the African continent. So malaria is extremely important in our communities, the elimination of malaria, because it makes it so difficult for children to learn. We focus a lot on the under fives because those are the ones who die, very rightly so. But it also has a huge impact on learning ability of our children. First of all, when a child gets malaria before the school going age, it affects their cognitive development. So their cognitive development is compromised from the first time that they get malaria, even if they get it in vitro, that is when they are still in the mother's womb. And then during the learning process, during the school years, lots of children get malaria every single year, and it inhibits their ability to learn. So these children's quality of education is compromised. And once learning potential of a child is compromised, as you know, the earning potential is also compromised. So the economic development and their ability to break out of the cycle of poverty is seriously compromised. So we really feel that malaria is an important marker of development. Those countries that are able to eliminate malaria will develop much faster. So malaria is a very, very important issue. It's not just about the health, and it is not about saving the lives. Those are very, very important, but it is also about driving down poverty, and it is about improving the health and well-being of communities. It's about equity, ensuring that everybody have got equal access, and everybody has got the right not just to health but to development as well. So what we do is we try to get every head of state to commit to this and to prioritize this. And what the heads of state do is that they elect one of their members to be the chair of this alliance every 2 years.
Fantastic.
And the chairmanship rotates between the regional economic blocks. As you know, in Africa, there is SADC, which is the Southern Economic Bloc. There is ECAS, which is the East African Economic Bloc. There is ECOWAS, the West African Economic Bloc. And then there is the Central African Economic Bloc. And then there is the Horn of Africa, which is called IGAD. So all of these are the areas which are malaria endemic on the African continent.
And could I ask you, the landscape of malaria control has changed enormously during the last 2 months.
Yeah.
Could you tell us and explain to those of us who maybe aren't so aware of these issues, what is going on and how is it affecting everybody?
There has been a huge, I should say, seismic change in the fight against malaria. Gradually, I would say over the past 10 years or so, development partners have been reducing ODA, and malaria has not really seen that marked reduction but there's been a small reduction from the UK government, Canadian government, etc. But it has been gradual, and it has not had such a huge impact on malaria. But when the US government decided that they are now going to close down PMI, that is the US President's Malaria Initiative, they are also going to reduce development assistance, that is reducing USAID. It has had a huge impact on malaria programs in our countries. The US government has been a major funder, not just of our governments, through the US President's Malaria Initiative and through being a major donor to the Global Fund, which is another major funder to malaria programs in our countries. But it has also been supporting a lot of civil society organizations to deliver health services. And in Africa, the governments, yes, are responsible for delivering primary health care, but a lot of religious organizations also deliver primary health care, and civil society organizations, lots of them also supported by religious groups, also deliver primary health care. And a lot of these organizations, society groups, hospitals, clinics run by religious organizations, we're relying on ODA from USAID and from the US government. So what it means is that some of them have closed down. I was actually in Khayelitsha, which is a squatter camp in Cape Town during the Easter break. I went to one small Roman Catholic church there, and there were so many of these clinics. There were 3 clinics in the squatter camp. One of them was outside the squatter camp, which I visited, and all of them had been closed because they had been supported by USAID. And I'm told that this is not unusual. It is common throughout a lot of our countries. So this is the huge impact. What it therefore means is that the malaria programs that we were previously able to deliver are now being compromised. And what it means is that there is now a bigger burden on the community health workers that are responsible for delivering these programs, because they will have less tools that they can actually use apart from just the education and the behavioral change programs, but they will have less rapid diagnosis tests for malaria. They will have less ACTs to share with parents, less long-lasting nets to protect children, mothers, and pregnant women. What it really means is that we are going to see more deaths. So this is the current situation. It is being exacerbated by climate change. There were huge floods in Southern Africa this year, and these floods, accompanied by the rise in temperatures, leaving huge pools of standing water, ideal breeding sites for mosquitoes, has resulted in massive outbreaks, even in countries which had low malaria endemicity, like Botswana, like Namibia, have now had huge outbreaks, which have resulted in a considerable number of deaths that they have not seen for decades from malaria. And of course, other parts of Southern Africa, like South Africa, like Mozambique, like Malawi, like Zambia, all of these, Angola, they have been adversely affected. So the effect here of withdrawing funding plus the impact of climate change is catastrophic. So there is a need really for partners to come together, for new partners, skills to be harnessed. We are asking, for example, for climate change activists and ministries of environment, ministries of agriculture that deal with climate change to appreciate the impact of climate change on malaria, and to look at the fight against malaria as an adaptation strategy for their communities in order to assist our communities handle the effects of climate change.
thank you so much for that masterclass of explanation of where we are, of what is happening, and the urgency to respond to the very difficult situation we're in. May God bless you and all the work that you do. Thank you so very much indeed.
Thank you very much.